Leicester MBA Online Learning Experience 2020 Reimagining Management in the Shadow of COVID-19 Maximizing Contactless Information Sharing. This video is presented by Team TriOLE with team leader Eslam Eldesouky from Module 2, Jason Coyne, Deputy Leader from Module 1, Amr Elsayed from Module 3, with Dr. Olga as our team mentor. Contactless Innovations: How organizations can maximize contactless information sharing post-COVID to continue to protect their employees. We have identified 4 types of contactless information sharing ideas which we think will benefit organizations the best going forward post the COVID-19 pandemic. These include virtual meetings, payment services, document sharing platforms, and mobile applications. Virtual meetings come in the form of 3 main types: teleconferencing, video conferencing, and web conferencing. Each of the different types of virtual meeting has its advantages and disadvantages as set out in the table on your screen. The next form of contactless information sharing is financial, through contactless payment services. Some examples of these are Apple Pay, Google Pay, Samsung Pay, and the all-reliable PayPal. Again, there is advantages and disadvantages to contactless payment services, and these can be seen on the table on the screen. The next form of contactless information sharing is the document sharing platforms. Some good examples of document sharing platforms include Google Drive, OneHub, OneDrive, and Dropbox. You can also see the advantages and disadvantages of document sharing platforms on the screen now. And the final form of contactless information sharing is the mobile application services. Examples of these include e-wallet type apps, food delivery type apps, and now lately the COVID testing and results apps and the COVID tracing apps. And again, like the other forms of contactless information sharing, the mobile application services also has its advantages and disadvantages. So, how does contactless information sharing protect our employees? Contact transmission is the most common form of transmitting diseases and viruses. There are 2 main types of contact transmission: direct and indirect contact transmission. Direct contact transmission occurs when there is physical contact between an infected person and a susceptible person. Infection spread when disease-causing microorganisms pass from the infected person to the healthy person via direct physical contact with blood or bodily fluids. Examples of direct contact are touching, kissing, sexual contact, oral secretions, or contact with body lesions. Indirect contact transmission occurs when there is no direct human-to-human contact. Contact occurs from a reservoir to contaminated surfaces or objects, or to vectors such as mosquitoes, flies, mites, fleas, ticks, rodents, or even the household dog. Indirect contact infections spread when the infected person sneezes or coughs, sending infectious droplets into the air. If healthy people inhale the infectious droplets, or if the contaminated droplets land directly in their eyes, nose, or mouth, they risk becoming ill. Droplets generally travel between 3 and 6 feet and land on surfaces or objects including tables, doorknobs, telephones. Healthy people touch the contaminated objects with their hands, then touch their eyes, nose, or mouth and become infected. Not all disease or virus or infections are spread through direct or indirect contact transmission, but the most common ones are listed below in the next two slides. So what can we do to reduce disease transmission? Maximising contactless information sharing, frequent and thorough hand washing as the best method to prevent disease transmission, regular disinfection of frequently touched surfaces such as doorknobs, handles, handrails, restroom surfaces, medical instruments, computer keyboards, phones, office supplies and children's toys. Using barriers such as gloves and face masks can help avoid the spread of germs. Many infections can be prevented by keeping healthy with attention to good personal hygiene and avoiding unnecessary physical contact. Going forward, organisations should take note and consider the following points when it comes to maximising their employee protection. Encourage the use of contactless payment methods. Increase the use of virtual meetings and limit the number of physical meetings. Invest in secure document sharing platforms and use existing trusted mobile applications. And finally, take the opportunity to develop industry-specific mobile applications. We will now give you 3 examples from each of our own industries of how contactless information sharing can be used going forward. Not every person who rings for an ambulance needs an ambulance, or in fact needs to go to hospital. Organisations should be looking at video conferencing with medical professionals giving advice to those people who are non-emergent and do not need an ambulance. With the advances of hardware and software in the IT sector, ambulance services should use this opportunity to move over to mobile data devices such as tablets for their patient care reporting. These tablets are easy to clean and eliminate the need for pen and paper, which can be the cause of the spread of infections or virus. These mobile data devices or tablets can also be used for sharing information between the ambulance crew and the hospital staff using Bluetooth or Wi-Fi, again reducing the risk of the transmission of infection from person to person. Unlike all organisations, ambulance services can now take the opportunity for the increased use of virtual meetings and reducing physical meetings to help protect their employees.
Contactless innovations. Now I'm going to talk about contactless in food business. During the pandemic of COVID-19, we all noticed that the consumer behavior has been changed. Also, the demand in market is moved down. In order to get back our customers, we must be more innovative. For example, I am working in Domino's Pizza of Kuwait, and we had applied innovative methods to get back our customers. Let me explain what we did. We applied contactless payment services, so we can send link with the invoice amount to our customer. This link could be sent through SMS, WhatsApp, emails, and even any other social media applications. Other methods, we had informed our customers that we will place your order on your doorstep, and if you would like to pay your invoice directly with your cards, we will place payment machine with the order, so the customer can place payment card in the payment machine by himself. Definitely, we had trained our staff to step back 2 meters, and every driver has a table set with him with sanitizers. And finally, after each delivery process, all used tools must be sanitized. Thank you.
Here I will speak about how to maximize contactless in construction industry. This slide shows the minimum requirements for physical work at the site. All laborers and technicians must wear hard hat, safety glasses, high vision vest, and safety boots. For engineers, inspectors, and HSE staff should add gloves to previous 4 PP items. All employees, either labor or staff, should wear face mask until sanctions are lifted. This slide shows the precautions measures for staff who is doing office work and wants to conduct a meeting at the workplace. Organizers of meetings and events need to consider the potential risk of coronavirus. Consider whether a face-to-face meeting is necessary, or we can replace it by teleconference or online event. If the meeting is essential, can it be scaled down so fewer people can attend? Ensure a spacious meeting space so participants can sit at least 2 meters apart.